Hi, I'm Dr. Adam Crane. I'm a clinical psychologist with the Kane Center. And this is the Behavioral Change Series, the psychological side of weight loss surgery. And today's topic is to discuss self-esteem and self-image, and to discuss the relevance of why this matters in trying to lose weight successfully with the bariatric procedures. So to start off, let's identify what the treatment goals are for today's session. The goals are to recognize how obesity and certain societal biases can impact your self-esteem and your self-image. Also to understand the emotional and behavioral changes that can occur from losing weight through bariatric surgery. The third goal that we want to try to achieve here is to identify the potential self-concept pitfalls that can occur after your surgery. So as far as transitioning from one sense of who you think you are to another with the weight loss, just the ways to be better prepared for that. And lastly, we want to try to learn some strategies to challenge old ways of seeing yourself, and just so you can prevent weight gain and weight regain after your procedure. Sometimes old habits are difficult to shake, and it's important as you transition from different eating habits into new, healthier lifestyles, that there's different ways that you need to adapt to be able to see yourself in a more positive, healthy way. So those are the goals for today. And in particular, let's start off with what self-esteem is, because it's a general concept that a lot of people have a good sense about, but just for the sense of a working definition, what is self-esteem? So simply put, it's the measure of just how good you feel about yourself. And you can have either positive or you can have negative self-esteem depending on your self-concept. And more specifically, just the degree to which a person values and respects themselves and is proud of their accomplishments. So as you go through the surgery, you need to believe that you can achieve weight loss. And it's been sometimes a difficult climb for a lot of folks because of a history of poor outcomes with traditional diets or exercise programs. And that it's happened enough times that you start to doubt yourself. You start to question whether or not you can continue to do this well. And so if you value yourself, you value your belief in your ability, and your self-esteem is more positive, you have a better chance of being more successful in the long run. So as I say here, you need to believe in your efforts just to believe to achieve any goal, including your weight loss. Too often there's a lot of focus on the long range end goal of weight loss, what the scale might read. And what really helps people along is just putting in the right effort, trying. Even if it doesn't go successfully the first time, that you keep at it, you find different ways to solve the problem, that eventually it leads to a better sense of your personal accomplishments and just trust that you can get something done. And this is something that does come up quite a bit for a lot of people going through the procedure. They identify that this is finally their time to take care of themselves. That this is finally a chance not to take care of the needs of others, and taking their time to be successful with weight loss surgery is something they really want to prioritize. And let me just emphasize, it is important that you do prioritize yourself, that you identify what your needs are, that you learn to be assertive and promote those needs as you go through this journey, because there will be some old familiar triggers and old stressors that might make you question your ability, might make you doubt yourself. It might make it that much easier for you to get off track with what you set out to do from the outset. So prioritizing yourself is a pretty crucial piece of building better self-esteem. So when we talk about self-esteem, I know a lot of people have a very general concept of what it is, but let's talk about some of the characteristics of it. So for people with low self-esteem, oftentimes they can be exhibiting symptoms of depression, just a general negative mood, don't really look forward to any kind of activities, don't really find pleasure in things that maybe they once found pleasure in. They can also feel a certain degree of insecurity, general negativity. They may question their adequacy, question their abilities to solve problems, their ability to feel capable of tackling new challenges. Sometimes there's also social withdrawal. Might just be easier to stay by yourself. And that's not an uncommon thing with people with weight issues, is that isolation does tend to be one of the more common characteristics. And also poor body image. A lifetime of up and down weight loss can lead to some questions about how you're supposed to feel about yourself, questions about how you're supposed to look. And especially as you go through the surgery, when you lose a lot of weight quickly, there might be the question mark, is this the way you thought you would look? Is this the way you're supposed to look? And if you have more of a negative mindset, a lack of ability to feel good about yourself, that may cause you to want to go back to some old habits to regain some weight, just to go with what feels more familiar. Sometimes behaviorally, characteristics of low self-esteem manifest themselves as poor eating habits, or just even emotional eating as a way to cope or to even compensate with potential problems or issues that may come up. People with low self-esteem also may have some unrealistically high aspirations. So this was an interesting idea that a lot of people feel you're supposed to set high goals. You're supposed to have this drive to want to shoot for the stars, for example. But if your goals are persistently unrealistically high, if they're just out of reach, what that does is it reinforces a sense that you're incapable. It reinforces that you just can't get anything done, or this is just proof that you're not good enough to meet those goals. So if they're just out of reach, the recommendation is make your goals a little bit more measurable, a little bit more reachable. Therefore, you can feel a little bit more accomplished in the smaller steps and get to the larger steps over time. If, like I was saying, if you never achieve your goals, it just serves to reinforce a feeling of inadequacy. And consequently, it just validates a negative self-concept. So for those people that have low self-worth, don't believe in themselves, they sometimes go looking for ways to prove it to other people. So if they fail at something, there's evidence, but it also means that they don't have to face the disappointment or the pain that may come from not being successful. Some other traits of low self-esteem include excessive concern about your weight and shape, body image that we talked about, negative self-image, and just some globally negative attitudes about your self-control and discipline. If you've never been successful with diets, or you've been successful up to a point, and then all of a sudden the weight creeps back on, or you just go off what the program would dictate you do, you may start to develop these messages in yourself that you're just not good at this. You just can't do it. So to be successful with the surgery, it's important that you try to shed some of those old messages that diets may have taught you or try to ingrain, and just focus on what you know you can do well. Focus on changing those negative attitudes about your self-control and pay attention to some positive steps and things that are smaller scale that might help you to feel more capable, that you do have self-control and that you can exercise some discipline. These factors do become exacerbated by life transitions and stress. We're going well for a while until something sort of hits us out of left field that makes us question ourselves. It makes us realize that maybe the tools we thought we had don't necessarily translate into the new circumstances or work to address the stressful circumstance that may have come up. So when they challenge our routines, they force us to question ourselves and to say things like, am I really capable enough, or am I good enough to do what I set out to do? If we have low self-concept, we may feel that we're not. And as a result, we quit. We quit too early. We don't want to face the disappointment that's ahead. And so we stop pushing ourselves because the pain of realizing that we're genuinely not adequate enough sometimes is too much to bear. With the procedure, it's important to recognize that this is going to be a slow stage kind of adjustment. The weight loss is quick, but sometimes the adjustment to your lifestyle, the adjustment to how you see your capability does take longer time. And it's going to give you an opportunity to try to learn about yourself along the way. So be patient with things that you may deem as mistakes. Be patient with feelings or thoughts that you can't do something, you can't continue this process, that eventually you'll fail at it because maybe you failed at other diets. If you recognize small stages of success, if you recognize at least something positive that you've done along the way, it helps to facilitate a better sense of accomplishment. And just being patient with yourself and more forgiving does help to maintain some of the goals that you set out with the weight loss. So let's get into a little bit more specifically about how do struggles with weight impact your self-esteem and your self-image. We touched on them just a little bit there, but that was more of a general sense of self-esteem and what to look for. But as far as how do struggles with weight, a lifetime of weight struggles, for example, several years, how do they impact and what kinds of things contribute? And the reason that this is important is because as you transition into a new lifestyle, as you lose your weight, as you start to see yourself as doing things differently, there will be questions of trust. There will be questions of sustainability. And we want to make sure that you're able to kind of see that the way that the weight has been impacted by societal factors, cognitive factors, emotional factors. So you've got some better ways of being able to address those. And so you can improve your chances of success. So to start off, let's talk about what's called obesity bias. And this is a form of discrimination. It's a form of stereotyping. So obesity bias is that people with obesity tend to be stereotyped early in life, and it creates unfair discrimination, unfair assumptions about your capabilities and who you are. So this is when you've gotten messages about people judging you based on your weight, assumptions made that you won't be able to be successful, that you won't be able to achieve much, that there's something that's inherently wrong with you because you have a weight issue. So in fact, if you've ever been passed over for a promotion at work, if you've ever been assumed that because of your size, there are certain things that you're just not good at, that is a form of obesity bias. If you've ever been ignored in a store looking for clothing because maybe the sales associate just figures that there's nothing there that would fit you, so why bother trying to help you? Those are all elements of obesity bias. And studies have shown that by age 6, children tend to show discriminatory views towards people with obesity. This is something that was published in the American Academy of Pediatrics in 2017. And when children start to see these differences between thin and overweight people, these biases tend to shape how people interact with them and to think about how obese individuals, how they think about them throughout the lifespan. In other words, if those messages keep getting reinforced time and time again, the person with the weight issue tends to ingrain some of those things. There is a safety in remembering negative messages versus positive messages, because the negative messages are safer. They keep us protected. We have an aversion to feeling pain and discomfort, and sometimes enough of those negative discriminatory messages that we receive as children throughout our lives helps us to keep safe. Unfortunately, what it does is it also keeps us feeling questioning of ourselves, doubting ourselves, lets us feel that we're not good enough, and it tends to promote more isolation. So as you go through this and you start to feel, as you lose the weight, more empowered, a little bit stronger, a little bit more confident in yourself, we want to make sure that you're able to look at yourself differently, to help build your self-esteem, to help build that you're capable, that now you feel that there's more of a sense you can promote your needs and challenge some maybe these old messages that you got. So it is important that you think about what were some of the old messages that you did receive growing up? What were some of the things that people taught you about yourself or wanted you to believe about yourself that maybe you ingrained? Maybe it makes you a little bit more self-conscious being comfortable in a social circumstance. Maybe there's a lot of self-doubt. If that's the case, try to pay attention to those things and find ways to challenge those automatic negative thoughts. Try to find ways to make yourself believe more of a positive view of who you are. And at the end of the talk, we're going to discuss some specific strategies of how to understand that and how to do that more effectively. So some of the other biases that come with obesity bias is that people assume that those with overweight issues have a lack of willpower or refuse to make the necessary changes to become thinner. There's an overwhelming pressure on a societal level that thin is the way to go, and that if you're not part of that group, then you must be doing something wrong. It's just easier to blame the person who has weight issues. The other assumptions maybe that overweight people are weak or that they want to be overweight. And I think that a lot of people don't quite understand that obesity has several factors that contribute to it, that it's not a matter of just willpower. It's not just a matter of desire, that there's a lot of societal factors. There's a lot of social factors, a lot of genetic factors, medical factors, things that contribute to why people have weight issues. And just to make the assumption that someone is desiring to be overweight is unfair. And there's a lot of factors that you'll need to consider as you lose this weight that help keep you going along the path of success. So just to give you some statistics, and this is meant to give you a general sense about what is more of a common theme. I talked earlier about how people with weight issues do tend to isolate themselves, sometimes because they see that other people might be successful with weight loss. They don't feel that they are, that it just must be them, which of course promotes lowered self-concept and lowered self-esteem. And what they fail to realize is that there's a lot of people out there that share some of the same experiences, that it's more of a commonplace issue than what's given credit. So along those lines, the statistics are that 45% of adults say they're preoccupied with their weight some or all of the time. Now, this is an 11-point rise since 1990. And that means that we're becoming more concerned about our weight. People are struggling to keep weight off for a variety of reasons. And it's more and more commonplace that this is quite an epidemic in this country. Nearly half of 3 to 6-year-old girls say that they worry about being overweight. So you can see at how young of an age this starts to develop, this idea of weight and self-image. And it's not unusual that now we start to see more people having these ingrained beliefs that there is a stigma about them and they get worried about their weight. And sometimes that leads to questions of adequacy, questions about good enough, of socially fitting in. Another study, this is in Bariatric Times in 2017, it was published that 91.5% of the 461 participants reported they have experienced a weight stigma. So it's very common that people who go through histories of obesity find that they get discriminated against, that there's some sort of judgment made about them because of their weight. Now, one of the other factors that makes this challenging is that the way that the diet industry is constructed, and there's the belief that diets are the way that you should be losing weight, and that if you can't lose weight through a diet, then it must be something about you versus the way the program is designed. And since 1959, the research has shown that roughly 95 to 98% of diets, attempts to diet fail, and that roughly 2/3 of dieters gain back more than what they lost from the original outset. And it's natural and it's easy for people to make an assumption that it's something that they did wrong. Because if the program is out there, it must mean that it works for a lot of people, that if I didn't do well with it, it must be me. And it could actually, nothing could be farther from the truth. There are a lot of reasons why diets aren't successful for many people, 95 to 98%. And it's important that as you go through this procedure, you understand that. So this isn't just some inherent assumption that you're just bad at dieting, that you can't lose weight, because there's really not much to stop you from having that mindset that as you go through the surgery, you're restricted with your eating, you're losing weight. It could resemble the dietary mindset. And you could question yourself. And if you start to plateau, maybe you give up. Maybe there's a question mark about whether or not you can continue to do this well. And we want you to shake that mentality, because the weight loss surgery and the lifestyle afterwards is a very different approach. It's more about a lifestyle than it is about a specific diet and specific restriction, which makes it very difficult for anyone to be successful. So part of the reason for that is, let's talk about the vicious diet cycle. So this will hopefully explain a little bit more about why diets aren't successful for a majority of people, actually. There's a psychological cycle to it. There's also a physiological cycle to it. So as you can see from the diagram here, that maybe you feel out of control with food, maybe you feel out of control with your weight. And so then that's usually the trigger point for most people to start a diet. And what they do is they restrict their eating, decrease their calorie intake, limit themselves on certain kinds of foods that they can or can't have. So normally this can be sustained for just a short period of time. On average, most people diet for about 3 months. And with this restriction, there comes what we call the famine response. We tend to lose weight more from lean muscle and from some from fat. There's a reduced metabolic rate. Our bodies tend to not like this very much. So there is an increase in fat storage. So any weight loss in particular, so as it says here, losing just 3% of your body weight tends to equal a 17% slowdown in your metabolism. So your body does tend to work against you in trying to lose weight. If it senses that you're trying to restrict calories, your body technically gets nervous. It doesn't want you to lose your energy stores. So what it does is it slows down the weight loss, holds on to what it has in reserve, just in case there's not enough food coming down the line. Once you hit that plateau, what happens is that your body responds with a blast of hunger hormones, ghrelin and leptin. Now, ghrelin is reduced with the surgery. So ghrelin is what stimulates your appetite. It's what lets you feel that you're actually getting hungry. So with the weight loss surgery, typically the ghrelin is reduced and you don't feel as hungry, which is part of what helps it to work so well. Leptin is a hormone that tells you when you feel full. So typically with stress responses, which diets can be, your brain is telling your body that basically there is a decrease in leptin, which means that you're not feeling full. which means your body is trying to encourage you to eat more because it's worried about the weight loss. It's worried about not having enough energy reserves. So you plateau. Once you plateau, essentially the psychological pieces kick in. There's self-doubt, there's guilt, there's depression, there's worry. There's all sorts of factors that make it so you question yourself because you don't know otherwise why maybe you aren't losing weight, why it seems to be the same repeated pattern. And as a result, people come up with various excuses, various rationales to try to explain why they're not losing anything. Or to kind of not have to face the disappointment later that this won't work for them, maybe as other diets haven't worked. So typically what people might say to themselves are things like, well, this isn't working, I might as well eat whatever I want. If it's not going to work, why not just keep trying? Why not just do what I want to do? Or you know what, I'm just going to enjoy my weekend. I've earned it. I've worked hard. Let me start again Monday. And unfortunately, maybe Monday is a perpetual day. It doesn't necessarily come where you want to start again. So with the diet cycle, it comes with restriction, usually the famine response, that plateau. And then there's something that we call reactive overeating. Once we give ourselves permission to indulge, to cheat a little bit, we haven't had carbs in a while, we haven't had sweets in a while, we deserve the little treat, we tend to go overboard. We tend to do much more than what we are supposed to have or what we normally would have. And it's classically called binge eating. So diets, interestingly enough, are kind of the most reliable predictor of binge eating behaviors out there. Once we start binging, that's when we start to really feel guilty and we start to really feel badly about ourselves. And as a result, the shame of it says, you know what, I'm out of control. I need to start another diet. And the whole thing starts all over again. So keeping off weight means you're fighting your body's energy regulation system and you're battling hunger all day, every day. What's different with the weight loss surgery is that restriction, that reduction in ghrelin reduces your appetite, gives you only a proportional amount of food that you can have in response to hunger, and keeps you off that diet cycle. But if mentally you're still ingrained with the diet cycle based on numerous attempts to try to lose weight through dieting, you may try to push through it just because it's what's familiar. Those old excuses, those old messages, those old things that stave off your worry that you're going to maybe regain weight or you won't be successful, maybe gets you to kind of engage in some old habits that are counterproductive to what you're trying to achieve. As I was saying, the drive for thinness can be overwhelming, as the belief that the only way to fit in is by being thin. So the isolation is important to consider. Fears of judgment usually typically equal a preference for being alone because some people just don't want to keep facing other people's criticisms or judgments or advice about how to lose weight. Some of the reasons why overweight people might avoid a doctor's appointments. If there's ever been times where you've been told medically that you need to try to lose weight, but not really given the guidance that's necessary, it might just be in your mind easier to avoid your appointments. I'm encouraging you, please, as you go through this procedure, to keep your medical appointments, talk with your surgeon, talk with your team to help you with resources to help you to stay on track if you find yourself struggling, but also just for some increased accountability. So as we were saying before, there's a lot of factors that contribute to self-esteem, a lot of factors that might contribute to weight issues. So where might low self-esteem negatively impact your success with bariatric surgery? So if people with obesity have low self-esteem, if going into this procedure you have questions about yourself, you doubt your abilities and so forth, losing weight challenges your sense of identity. You may have built a lifetime of seeing yourself a certain way, learning how to protect yourself from some of those negative criticisms that maybe you got growing up. If you have a history with the diet cycle of not being successful with weight loss, it causes you to question yourself. So when you do lose weight, it forces you to see yourself in a different way. For some people, it's not so easy to accept that this is now the new norm, that this is now you can be successful. There may be some doubt, there may be some lack of trust that that's going to be sustainable. And so the weight loss sort of thrusts you into this new way of seeing yourself that you may not be mentally ready for just yet. That does take time to develop. And it takes a series of non-scale victories to kind of prove that you can do this, to prove that you are going to be successful in the long run. If you don't find those smaller scale victories and that sense of doubt and questioning kind of overwhelm you, it might just be easier sometimes to go back to old eating habits because it just feels safer. It just feels more familiar, even though it may not be the healthiest thing for you. And if you know low self-esteem has led to using food as an emotional coping mechanism, it might be more difficult to find alternative ways to cope post-operatively. You know, food becomes a very easy, safe way to feel comforted. And certainly there's a surge in dopamine, especially if we're consuming a lot of sugars, that makes it so that we feel good, that it's a short-term immediate blast of positivity to feel better about ourselves. So if you are using food as an emotional coping mechanism, it's going to be important that you find alternative ways to deal, other ways to build self-esteem. What do you like to do? What makes you feel good about yourself otherwise? Because if it's just food, sometimes that just masks feelings that you have and limits your ability to see yourself successful in other ways. You know, and again, self-esteem, it's going to cause you to maybe doubt your ability to maintain your weight loss success. So even if you do lose the weight, even if you are successful to a point, there may always be that question mark about how long can I keep this going? You may not have much experience with dieting to be able to sustain weight loss in the long run. So sometimes low self-esteem does contribute to those factors. There's also the possibility that for some people with low self-worth, they use their weight as a way to protect themselves from having to take on new challenges. If you've always doubted your abilities and your weight becomes an easier way to basically question yourself or to limit yourself, once you lose the weight, that excuse gets eliminated. And then you have to really trust, is it okay for me to try to succeed? So if you still need that defense mechanism because you doubt yourself, sometimes putting weight back on becomes a reasonable excuse. But at the same time, the challenge becomes how to see yourself in a more positive way, how to believe that you can do something that, yes, it may be scary, it may be feeling increased feelings of vulnerability. But if you can appreciate some of the small victories that you have and that you have made, maybe you can start to trust that you can keep this weight off and that you can achieve what you may have doubted previously before. Let me talk a little bit more specifically about self-esteem eating. So essentially, what it is just simply using food to feel good about yourself. Or conversely, it could be using food to feel badly about yourself, to reinforce that negative sense of self as we were talking about earlier. So people might eat when their self-image is poor because food is that comfort that helps to repress painful thoughts or feelings when you have to focus on yourself. So a statistic here is roughly 79% of people report using food as a coping strategy for dealing with weight stigma. So it becomes that vicious cycle therein, that if you have feelings of being discriminated against or having used your weight against you, you may turn to 79% of people to use food as a way to cope with that, which just perpetuates the vicious cycle of being exposed for stigma and judgment. So aside from distraction, food can also validate how you might see yourself. I was saying before that self-esteem could be using food, could be feeling good about yourself, but self-esteem eating can also be a way to reaffirm feeling badly about yourself. So if you do feel badly or negative about yourself, a poor food choice might reinforce that self-concept. If you're already feeling badly, if you're already feeling inadequate or incapable, sometimes going for bad food is just sort of a way to prove it. You almost go looking for the evidence of ways to show that you're not necessarily worth better treatment, healthier lifestyle, so forth. And that could be another thing that gets significantly in the way of losing weight and appreciating what the surgery can do to keep you on a consistent path where diets have failed maybe in the past. As I was saying before, it's not even just about the weight loss. Sometimes it's about self-image. And so let's talk a little bit about self-image and how that gets impacted and how that might be a deterrent for greater success or just some things you may need to adjust to with the surgery post-operatively. So some people with self-esteem concerns, they do struggle with accepting their new self-image. Part of it is because they're not familiar with seeing themselves in a more positive way. In other words, they look in the mirror and that person staring back at them isn't necessarily the person they expected to see. They still have in their mind the person that was prior to surgery, the pre-surgery identity. It's safer, it's familiar, it's easier just to stick with that than to start to find other ways to accept that this is the new you looking back. There also might be a fear of change and a reluctance to see the results that others might notice. So if you're finding you're somebody who has a hard time accepting compliments, you're dismissing them a little bit too easily. Sometimes that's a way to kind of push back other people seeing you in a positive way. Why would you want to do that? Well, it's something we call disqualifying the positive. And if you have a negative belief about yourself, and that's your familiar and that's your safe, and you're not ready to start making some changes, sometimes other people noticing it before you're ready to it feels a bit threatening. It feels that you're not someone who is either deserving of their praise or their recognition. You've never been recognized for any positive achievements, or it might be that it's too quick. Somebody recognizing it might mean that now you're accountable to other people's opinions about how you look and to basically keep up the weight loss. And B, sometimes you feel that you don't necessarily deserve it. Sometimes there's a feeling that because with low self-esteem, you're not capable of achieving your goals, you give almost too much credit to the surgery. You didn't lose the weight, the surgery lost the weight, which is not true. You need to be the one that takes ownership for what you've done to make the surgery work as that tool that's been discussed so often throughout this process. Now, accepting yourself is a gradual process. Sometimes it's important that you look at yourself in the mirror and just find some things that you do agree with that you can recognize. Sometimes that when someone gives you a praise or a compliment, that you kind of recognize what the intent of the compliment is instead of being so quick to dismiss it and get rid of it, that you look at it and say, I see what they mean, and appreciate that you are making some efforts. And sometimes it's easier to appreciate efforts that you made or factual, reality-based kinds of proofs that show that you are making headway with your weight loss. So for example, for someone to say to you, you look great. Great is one of those terms that's a little bit more debatable. Your definition of great may be different than my definition of great. So it's easy to kind of dispute it. But if someone says, wow, you look like you've been working really hard at your weight loss, that's a lot harder to dispute because maybe you have been working hard at it. Maybe you can recognize that if they say, look, your clothes look like they're a lot looser. That's more of a measuring stick to say, yeah, they are looser. It's harder to debate that. It's more, you're more inclined to have to accept those kinds of compliments. And as a result, give yourself more credit for what you've achieved. Now, one of the questions that I do get from people is, does weight loss and a new self-image mean you have to be a different person altogether? And from my anecdotal experience, no, I don't think that that's the case at all. You may not recognize the person you see in the mirror, but that doesn't necessarily mean that you're a different person. You know, you have to accept that maybe there's parts of your personality that because of the stigmas that societal pressures put on, of just weight loss bias, obesity bias, that it caused those elements that you really wanted to bring to the forefront. Maybe you put those down a little bit. Maybe they've been lying dormant for a while. And maybe the weight loss is just an opportunity to bring those things out a little bit more strongly. So in other words, I'm not saying that your personality necessarily changes, but maybe with weight loss, there is a greater sense of confidence and you want to allow other elements of your personality to come out, elements that you would have repressed maybe before. But it's important that you kind of try to pay attention to what it is that this other person is, who this person, what they're suggesting that you need to be now, or that maybe what you want to be. You know, what are you liking compliments? Are you enjoying the energy that's coming from the weight loss? And is that okay? Is that something that you can embrace? And if you're pushing back against it, then why? What are your reasons? What are you trying to protect yourself from? This is all just in the interest of trying to understand how to be a little bit more self-aware and to challenge self-esteem that may have been a problem for you in the past, but not just with weight loss, but maybe this is an attempt to try to improve your self-concept. So why is it so difficult to accept these weight loss victories? You know, we've been touching on these, but to kind of sum them up a little bit more, because maybe there's been repeated unsustained results from having lost weight through traditional diets. Like I was saying earlier, the vicious cycle with diets, you've been through this pattern enough times, you don't want to keep disappointing yourself. It's something called overgeneralizing. You see a single negative event as a never-ending pattern of defeat. We believe that no matter what we do, it's always going to be the same outcome. So sometimes it's difficult to embrace this change because there's a trust that you don't want to set yourself up for disappointment yet again. There's also the fear of living up to other people's expectations. In that, people with weight issues sometimes like to isolate themselves, or there may be a history of negative messages about obesity. Once other people see that you're trying to lose weight, if they have encouraging hope for you, if they give too much positive attention, maybe it means that no longer is this just about you. Maybe at the end of the line, there's going to be a criticism if you don't lose any more weight, or if you don't measure up to what they think you're supposed to do with this. So sometimes the fear of living up to what other people want for you makes it hard for you to accept your weight loss. That's why when we talk about needing to make the surgery about your needs and about yourself, it is so crucial that you find reasons why this matters to you. If you do this for other people's benefit, if you do this with the hope that other people will like you better, that's the wrong reason to want to try to lose weight through surgery. You have to be able to say why this matters in your world, what's going to be better about your life once you lose this weight. So trying to live up to your own expectations versus living up to other people's expectations will help to challenge some of the self-esteem, will also help you to feel that you can feel more comfortable moving forward with some of the choices that you make versus fear of being criticized for some decisions that you might make with food or with other things that other people may not understand. As I said just a few minutes ago, giving the surgery too much credit. So the analogy that I like to use is that if you've ever driven anywhere in your car, that's like giving your car all the credit for getting it to where you were trying to go. Surgery is a tool. It is just a way to get you someplace. It's the vehicle that gets you to your destination. You have to give yourself credit of all the choices and all the changes that you've made along the way. The surgery is there to provide a framework and a way to make it more facilitated. But just as you get in a car, you choose the speed, you choose the route, you choose where to turn, you choose the song that's on the radio. Those things are all your decisions. That's your victories. Those are the things that made the car work best as it's meant to be as a tool. Surgery, you pick the foods, you pick the exercise schedule, you pick how often you go to your doctor's appointments, you pick all sorts of ways to kind of try to give yourself a positive self-regard. Those are some more positive tools and some ways that you can take ownership of the surgery and not let the surgery be the only thing that is the reason why you've lost weight. If you do that, then there's not as much accountability. There's more of a likelihood that you might put weight back on in the long run. Now, with self-esteem, another thing that you need to consider is your role identity. What I mean by that is maybe struggling with weight, there were certain ways that you saw yourself based on messages, based on the way that society kind of had challenged you to feel self-criticized. So as you embark on this, you're not just making changes and choices with your eating habits, but you're also maybe taking some changes about who you want to see yourself as. So for example, if you were more shy or withdrawn, or you weren't very assertive because you were worried about more negative attention based on weight issues and obesity bias, is this an opportunity for you to see a different kind of role? Do you want to see yourself as more assertive? Do you want to see yourself as more of a leader? Do you want to see yourself as more outspoken and less reserved? These are all decisions that you will get to make. And maybe you don't have those issues as it is right now. Maybe there's some other roles that you would like to fulfill. But sometimes the patterns with weight, and we talk about this in some of the other discussion groups, family history, make it so we feel our weight serves a particular purpose for our families, for other people, for our friends. When you lose the weight and you start to see yourself in a different kind of way, you have the opportunity to try to live a different lifestyle. So I'll give you a little analogy. So there is someone that I used to work with who had the surgery and lost a significant amount of weight. And what they would talk about is that when they would go out to clubs with their friends, before surgery, they were the ones that the friends assumed would just hold the coats, watch the purses while they all went off and danced. And this was her role. This was the way that she was kind of accepted into her group. Once she lost her weight and she started to feel more empowered, she started to have more energy and she wanted to live a different kind of lifestyle, she decided that her role needed to change as well. Her friends had a harder time accepting that she wasn't going to be there for them in the way that they were familiar. But she decided that she didn't want to be that person anymore and she wanted to get out there and dance. So after her significant weight loss, She ended up making some different friends that were more appreciative of who she was, what her value was, versus not just what she can do for other people. And that's just one example, but there are countless other stories like that of people that now need to transition into what works for them versus what works for other people. On the physical side, there's also some dissatisfaction with loose skin. Sometimes with a rapid weight loss, skin doesn't exactly snap back into form, depending on your age, depending on your body type. You may have some skin that sags, and for self-image issues, that might be challenging to be accepting. So if it is something, I would encourage you to talk with your surgeon about what possible options that might be available. But if it's something that you can learn to live with, if it's something that you can kind of learn to be, see the larger picture of your success versus just only hyper focusing on the loose skin, it would be better. There are some people that have a hard time getting past that there's some body dysmorphic issues, being highly critical and disappointed with how certain elements of you look. And that can come from low self-esteem, from a history of depression. It's just another way to be self-critical. If you think that might be something that might be an issue, it is important that you address it, maybe through some psychotherapy or just some self-reflection over time, just to kind of learn to accept yourself and be more appreciative of other elements of who you are and your self-image. Okay. So continuing on, as far as how is it that you can build better self-esteem? How can you embrace your new self-image in a better, more healthy way? Now that you understand some of the factors that contribute and other things that could deter you from being successful, how do you make this better? And I've touched on this a little bit, but just the first thing that comes to mind is you need to accept yourself gradually. Like I said earlier, the weight loss is quick. It happens over a very short period of time. And you need time to accept the emotional, the mental changes that, and the behavioral changes that you're working to make more of a continuous process. Change can be very frightening. A lot of people are resistant to the idea of change because they're not quite sure what they're supposed to expect on the other side. You need time to adjust to your new way of thinking. You need to be patient with yourself. You need to recognize the small things along the way so that once you get to the larger goals, it's a little bit easier to accept. So there will be days where you have self-doubts. There will be days where you feel inadequate or not sure that you can sustain this, but try to fall back on things that you've already done well. And that's the second point here. Identify what positive tools you already possess. Find evidence of how you've already used them very well. One of the struggles that I see a lot of people going through is that when they've lost weight, for example, they have no idea how they're going to sustain their success. And one of the things I like to ask about is, what have you already done? Like, what are some of your positive tools that you've used so far that have gotten you here? And there are several people who don't know, but I encourage you to try to give yourself credit. Low self-esteem can cause you to dismiss some of those positive tools that you've built. That's that idea of giving the surgery too much credit. So find evidence of where you've made better choices. For example, if you've gone to the grocery store and you've avoided all the sweets aisles or all the carb aisles, give yourself credit for those positive tools. If you looked in the mirror for a little bit longer than what you really wanted to, you were uncomfortable, you didn't feel easy about the person that was staring back with the weight loss, maybe you stood at it a little and stared at it a little bit longer until you got more acclimated to being uncomfortable. You became more accepting of the self-image. That's a positive tool. You built up what we call your distress tolerance, your ability to kind of see yourself as handling negative experiences better. Some other goals include just setting smaller, short-range goals. Sometimes when we were talking earlier about setting unrealistically high goals, unrealistically high aspirations, that can serve as that reinforcement that you're just not going to be able to achieve anything. And that long-range, high aspiration kind of goal that you've never met is going to be your proof that you can't meet it. So with the surgery, don't necessarily set a goal of 150 pounds to lose. Set a goal of 25 pounds. Lose that. Appreciate it. Feel good about it. Then set a goal of another 25, and so on until you've reached your ultimate goal. But the smaller victories, the smaller scale victories allow you to feel that you've achieved something bigger. So large goals can be very demotivating. It's just easier for you to give up if you feel that it's too big of a mountain to climb. So if you picture yourself staring at Mount Everest, you may be turned away pretty quickly. It might be too hard of a achievement to try to take on. But if step one is just going to buy mountaineering gear, step two is to try it on to make sure it fits properly, to learn how to use it properly. Okay, you can manage that. Step three might be booking your trip to Everest. Step four might be training yourself physically. Step five might be getting to your first base camp and getting acclimated. Eventually you'll reach the summit, but not in one step. Small scale victories along the way, small scale proofs that you can get there. So small successes do equal better self-confidence, and they challenge your previous self-doubts. So if you are somebody with a lot of self-doubts, this is a way that you can try to challenge those and give yourself credit. It may be uncomfortable, you may still have doubts, but keep practicing, and it does get easier as you go along. Now, along these lines, there's something called growth mindset, which is part of another talk, the mindset and motivation discussion, where we want you to use something called growth mindset. And what growth mindset is the belief that you're not a finished product, that you are someone that is continuously growing and changing and improving upon yourself. And the only way to do that is to put forth effort and to appreciate that even along the ways with your effort, you might make some mistakes. You might not make the best choice. You might miss out on an exercise appointment or whatever it would be. But you need to use your growth mindset and learn from these so-called mistakes. Don't avoid problem solving. More of the fixed mindset believes that your qualities are fixed, that if you're bad at dieting, that is who you will always be. And the first sign of a challenge or the first sign of something that proves itself to be maybe out of the ordinary, you might quit, you might give up, because that just forces you to see yourself as, what if you fail? Then you don't want to have that reinforced. The growth mindset, on the other hand, helps you to learn from your mistakes. In fact, growth mindset people don't even see mistakes. They see them as opportunities. You made a mistake, you take stock and take inventory and what you learn from it, why did it happen, and you get better the next time. In other words, don't be perfectionistic. Try to just be in the growth mindset that as you lose your weight, as you adapt to this new lifestyle, that you will get there. And maybe every day, try to appreciate something that you haven't done before that you thought went well. Even if something didn't go well, what did you learn from it? How can you improve on it for next time? You can even start your day off with a goal as far as, what is it that I want to try to achieve? What are my opportunities for growth today? And try to structure your day accordingly. It's okay to have some anxiety. Anxiety could be either the fight or flight syndrome. You can either have some anxiety, some worries, and take on challenges, or you can have anxiety and be paralyzed by them and retreat. So you want your anxiety to be tipping the scales in the balance of motivating versus paralyzing. If you find yourself quitting or giving up or going back to that old dietary mindset, it's important that you try to find ways to be motivated, to face your disappointments, to find ways that you can be successful. Okay. So to continue with that, some more specific strategies here. In particular, you want to be what's called mindful. Now, what is mindfulness? Mindfulness is a state of thinking. It's a state of just being present, being in the moment. Sometimes when we worry, we think too far ahead as far as what if this won't happen? What if something won't go well? Mindfulness forces you to be more present. It forces you to be not self-critical. And in so doing, it actually increases a certain awareness, and it increases an ability to solve problems. There have been numerous studies done on mindfulness. One in particular was done where researchers, this was done through Harvard, I think it was in 2014, where they asked people, what are you doing? What are you thinking about right now? And this was over 2,000 participants. Those people that were more focused on their present circumstances versus the worry about what hasn't happened yet, or what might go wrong in the future. Those that were present on the focus on the present, they found that they were happier, they had less emotional distress, and they had more energy available to solve problems right in front of them. They had the ability to say, The future doesn't matter as much right now. What matters is what's right in front of me. So for example, if you're worried about what if I don't lose weight in the future, there's not much you can do about that other than what's going on today. Make a good food choice. If you're worried, you go to the gym. That's a specific tool that will help you to get yourself to make sure that that doesn't happen, that you're able to be successful. So focusing on what you can do in the present moment, appreciating that even if there's something that you feel is a mistake, as I was saying earlier, what you can do is be mindful, don't be self-critical, give yourself a sense of what can I do about this now, and learn to tolerate maybe your guilt about maybe that mistake, but turn it into an active choice to do something better for yourself. Another strategy is to challenge cognitive distortions. Now, what are these? So cognitive distortions, they are patterns of thinking that are usually a bit askew. They're usually a bit off base. They make perfect sense to us because we're the ones using them, but they may not make sense to other people. We sometimes use these to try to justify bad choices, to try to fill gaps when we're feeling negative, to try to remove the painful elements. So let me go over a few of these just so you have a sense of them. But if you find yourself using these kinds of methods of thinking, try to pay attention to them and try to find ways to challenge those so that you can be on the right path. So for example, disqualifying the positive. We talked about it earlier. This is when you dismiss a positive compliment, a positive experience of some kind, and just insist that it doesn't count. You can find all sorts of ways. Somebody says to you, hey, you look great, you've lost weight. Maybe your excuse is, well, the first 15 pounds is easy. I'm always able to do that. It's beyond this that I can't do. So don't be so quick to give me a compliment. So what you're doing is you're dismissing their praise. You're allowing yourself to stay safe because you're not ready to accept that someone else sees you differently, or that your self-concept has to change about who you think you are. You are growing into something, feeling more capable, and that's going to take some time. But if you pay attention to not taking compliments, not feeling comfortable with positive recognition, you might be disqualifying the positive, and that might be something just to try to learn to get better about accepting positivity, accepting some things about yourself that maybe you weren't so comfortable with before. Mind reading is another cognitive distortion. And what this is that you can assume that you know what someone else might be thinking about you, but you don't bother to check it out. So this comes from a long line of obesity bias, people discriminating, people giving you sort of a negative impression about how they see you. And if you stand in new circumstances and you assume that you know what people think about you because of your weight, you're mind reading. This happens when people lose a lot of weight and they're talking to somebody new, and they make the assumption that this person may have been judgmental about them prior to their weight loss, or there might be something else about them that they just don't like. That's based on safety, because what you're used to is people treating you that way. It's contributed to that history of low self-esteem that we were talking about earlier. So it's important that you try to check out some of these things. You may not want to directly ask them if that's what they're thinking about you, but you may also want to make sure there's other evidence to prove that they're not really being judgmental or critical. But that does take some time to get yourself to a place where you're willing to say that other people see you or think about you in a different light. Fortune telling being the next one. Fortune telling is predicting the future. It's guessing essentially what you think is going to be the outcome. So for example, because of a history of unsuccessful dieting attempts, you try the surgery and you may say, I know exactly how this is going to work out. I know that I'm going to lose weight for a while, I'm going to plateau, and then before you know it, I'm going to put all this weight back on. That's fortune telling. You're doing that because you want to keep yourself protected. You don't want any kind of negative surprises. You don't want to feel that there's anything about you that is going to be a disappointment. So you guess it. Once you know the outcome in your mind, you're feeling less vulnerable. But that doesn't mean that you're right. That doesn't mean that that's going to be the outcome. But it could engage you in a self-fulfilling prophecy. Once you predict that you're going to regain weight, for example, maybe you act accordingly. Maybe you self-sabotage. Maybe you find ways to prove that the weight doesn't stay off. And as a result, yeah, you end up being right and you guessed it correctly, but did you do things along the way to make that happen? And there's a number of these cognitive distortions, but the last one I'll talk about here are called should statements. Now, should statements are just simply put, the use of the word should. I should not have eaten that. I should have lost more weight by now. I should have gone to the gym. What should statements are, they're reinforcements. They're ways to remind you that, yes, you know the right thing to do. But should statements are also reminders of how you've been disappointing yourself. I shouldn't have eaten that means that you did eat something that maybe wasn't on the dietary plan. And then it's a reason for you to feel ashamed. I should go to the gym and exercise, or I should go for a walk. If you haven't gone for a walk yet or gone to the gym, the should is a reminder on some level that, yes, I need to do this. And I know it's something, I'm aware of it. But it's also a reminder of how you failed yourself, that you haven't done it yet. Because of that, it might actually promote more depression. So should is really a very passive voice. There's not much you can do about should. I should not have eaten that. Well, guess what? If you've eaten it, it's too late. You've already eaten it. So the way that you challenge should statements is that you make it more of an active voice. I will. I should not have eaten that. Well, you know what? I will accept that I ate it, and I will make a better meal plan going forward. I should have gone to the gym today. You accept maybe there's a shame or a guilt about not having done it, a disappointment. Make it an active voice. Create a plan, create a strategy to say, here's what I'm going to do about this. I am going to go to the gym and I'm going to exercise. There's still time left in the day to get this done. Or I'm going to go for a walk, or I'm going to do some exercise in the house, whatever it would be, but give yourself opportunity to challenge should statements with action plans. Other ways to build better self-esteem and better sense of accomplishment is label specific and attainable goals and meet them. Making a goal too vague just gives you room to not even engage in it. It's just a way of saying, I know to get around to it, but it also might make you feel overwhelmed. It might make you feel that you don't quite know how to achieve that goal. So if you label the goal specifically, it makes it easier. Let's say your goal is to exercise more. Your specific attainable goals, I'm going to go to the gym tomorrow at 10 o'clock and start with the treadmill. And I'm going to try to walk for 15 minutes. That's a very specific attainable goal versus I need to exercise. Too vague means that it's probably not likely that you're going to engage in it and you won't be as accountable to yourself. Other things that I was saying earlier is pay attention to your non-scale victories and not just your weight loss. Because if your weight loss isn't going well or you're plateauing, you might be demotivated. But the non-scale victories at least helps you to kind of feel that there's a progress, that you're doing something, even if the scale isn't moving the way you were hoping. So give yourself some non-scale victories, make a list of them, write them down. Journaling is a great way for you to kind of have recognition. In those days where you're not feeling very confident, you can look back on your journal and see that there were actually some victories to remind you that you've been successful before and you can continue to be so going forward. And along those lines, don't use the scale as a way to prove how poorly you're doing. In other words, don't weigh yourself every single day as a way to show that you're not making progress. Try to use the scale as a tool, but don't use it as a way to kind of prove yourself as having failed, in other words. Now, one of the last tools I want to talk about here is self-talk. Along the lines of the cognitive distortions, what self-talk is, it's a style, it's a process, it's a way that we communicate with ourselves, more of our internal monologue. And self-talk is just what we say to ourselves. So are we perpetuating negative messages? Are we telling ourselves that we can't achieve something? Are we telling ourselves that we can be successful? So obviously, to be the most successful with the surgery, you want to make sure that you have a positive self-talk dialogue that's going on, or monologue really, in your head. You want to make sure that you are, and as the chart here says, positive and optimistic, that you're logical, rational, and productive. Your positive self-talk should boost your confidence. If you feel it's a way of detracting, that's more of the negative self-confidence, the negative self-talk. If you're too focused on distractions, in other words, that's negative self-talk. If you're looking for all the reasons why you can't do well, that's negative. But positive, it heightens your focus. It keeps you goal-oriented. It keeps you focused on one specific thing to achieve. You attribute your success to replicable internal factors. What that means is that too often people with self-esteem issues might look at external factors as far as why they are successful or not. In other words, they're giving the environment too much credit for what's gone well or what's caused them undue harm or undue holding you back negatively. When you give yourself internal control in a sense of what you did to be successful, that helps with motivation. That helps you believe that you have the ability to achieve. And so you want to make sure that you have internal messages about what you did. Like we were saying earlier about the car, it's not just the car, it's about what you've done to do well. Give yourself credit for those tools. Other things, if you're motivated to push your limits, great. If you're mindful and you're focused on the present, that's all positive self-talk. If you're too focused on the negative in the past or on the future, that might be your negative self-talk. Proving to yourself what went wrong in the past, old dietary habits, why you won't lose weight. That's negative self-talk. And sometimes these processes, what makes them challenging is they are automatic. They can be negative. They can be unconscious. They can be telepathic. We just don't always recognize them. So the best you can, if you see yourself using some of those cognitive distortions that we talked about, or repeating the same kind of negative doubt in your head, write down the messages, make it more tangible, make it more obvious to yourself. And then you can learn to work on making it more of a positive self-talk approach. And the way you can do that is just through cognitive challenging. Look for the truth to a negative message. So for example, I'll never lose weight successfully on my own. If you recognize that as an automatic, challenge it and find the proof as far as why you have lost weight on your own and why you can continue to. Also, try to identify what purpose these messages serve. How do they help or how do they hurt you? Sometimes by making yourself more aware of these things and more conscientious of how these things have negative impact, it's easier to dismiss them. It's easier to give yourself more of a positive goal. So based on these messages, based on these tools and these strategies, hopefully you've gained some ideas about how to appreciate your self-esteem, how to recognize maybe if you have some self-esteem issues, how to work on them in a different way, how to feel better about yourself. Because it's just the idea that making sure that you trust your abilities, believe in yourself, have good sense of self-confidence and ability to achieve a goal, that will make you all the more successful with the weight loss surgery and sustainability in the long run. Thank you very much for attending this group in this talk. I hope it was helpful for you.